Hello, and thank you for listening to my walkthrough. My name is Joseph McCreary, and I'm going to talk today about the development of an orally administered nanoparticle vaccine to combat Clostridioides difficile infections. I'm going to take you through two studies that have been previously done quickly, and then I'll talk about what I'm going to do to improve the method of vaccination. C. difficile is a gram-positive, spore-forming, toxin-producing anaerobe. It is found throughout the environment and is the leading cause of hospital-acquired infections. Disease can range from asymptomatic carrier to or mild infection all the way to pseudomembrane colitis and lead to death. There is currently only 3 treatment options recommended, vancomycin and metronidazole being the most used of the 3. However, if you look at the common risk factors for C. diff, you can see that antibiotic exposure is one of the main factors. Antibiotics can be broad in action, and this leads to the destruction of gut flora, which is what intrinsically resists C. diff infections. So treatment with antibiotics can lead to further disruptions and can cause later relapses of disease. In our lab, one of the things we are looking at is trying to prevent C. diff infections before they are able to take place. And the way we would do this is through vaccination. And for us specifically, we're looking at oral vaccination, which eliminates painful injections and also delivers our antigens directly to the site of infection. In this first study that has been published, and the citations are at the bottom of the page if anybody is interested. In this specific study, recombinant TCD-B, which is a component of the toxin produced by C. diff, is encapsulated in a chitosan and PGA polymer. The encapsulated protein was then used in the following model below. Mice were immunized 3 times by IP injection, and before immunization and after each subsequent immunization, blood was taken to collect or look for specific antibodies. And what you can see looking at the graphs is that there's significant levels of antigen-specific IgG and IgAs. You can see that after the second dose of the immunization for both of them. After immunization took place, a challenge of C. diff was given to the mice. And what we can see in the survival curve is that 100% of the vaccinated mice survived the C. diff challenge. You can see in the pictures of the colon and cecum that the vaccinated mice still had some amount of degradation of their cecum and colon, but compared to the straight infected and empty vector, you can see that there's a radical difference in just visual observation. And like I said, the vaccinated mice were able to survive this C. diff infection. This was a great result in our eyes, and this was continued upon in the following study. In the subsequent study, or the second study that I'm going to talk about, they moved to an oral delivery of the antigen as compared to the IP injection that was used before. So the recombinant TCD-B protein was encapsulated in a amino acid-based polymer instead of the previous base polymer. And this was to help it get through the stomach acid and deliver the antigens directly to the gut. So following a very similar model of immunization and blood collection and infection, these mice again produced significant levels of antigen-specific IgGs and IgAs. However, this was after the third immunization where we see the large jump of significance. And again, we can also see that after challenge of C. diff, nearly 100% of the vaccinated mice survived infection. However, what we did see with this is that even though protection is given with the recombinant TCD vaccination, the problem is the amount of C. diff within the colon is still quite high. So these mice are protected and are healthy and are not dying. However, like I said, there's still a large amount of C. diff that they are shedding. So this is a problem because they could be asymptomatic carriers of C. diff. So this leads me to the portion where I'm going to talk about how I think I can improve this method of delivery. The first being is the improvement of the delivery system itself. We are collaborating with Dr. Josh Ramsey in Stillwater to encapsulate the recombinant TCD-B in a nanoparticle called U-Dragon. This polymer hopefully will offer more protection because this is specifically designed to be acid sensitive, so it can pass through the stomach acid without having any damage and then release our antigen into the intestines. Along with this, it would also help in targeting specifically M cells, which are the immune cells that line your gut. And so I have begun this process. I started following very similar protocols as previously for purifying recombinant TCD-B. So these proteins are cloned into E. coli, and then I induce the E. coli to produce large amounts, and I take these large amounts and purify them through a nickel resin column, and then I further purify using FPLC. We are currently waiting on our collaborators to encapsulate these proteins to begin animal work. The second way I believe I can improve this design is incorporating C. difficile surface proteins in the vaccination. There are several targets that are strong candidates and have been used in previous vaccine studies. These include SLP-A, FLE-C, and CWP66. This, in theory, could cause the production of neutralizing antibodies specific to C. diff rather than its toxin. Thus, it would eliminate the possibility of being an asymptomatic carrier of C. diff and decrease that bacterial load that we are seeing in the previous study. I propose doing this by making chimeric proteins that would contain the full or contain both recombinant TCD-B and a surface protein. This will allow me to produce both proteins at once, thus eliminating the long process of protein purification, and also it will guarantee a similar ratio of both antigens when encapsulating. This will hopefully have the benefits of the protection from the toxin and also neutralize the bacteria itself. Thank you all for listening, and I would like to thank our funding from OCAST and OSU. I would also like to thank all previous grad students that worked on this project under Dr. Hom. If you have any questions, you can email me at the email that is on this slide. Thank you again.